I would absolutely wholeheartedly vote to repeal the healthcare reform. What the federal government did was step into private industry, took over the medical insurance. Also, it took over the student loan industry. We're forcing people to have the insurance. That's not a requirement. It's unconstitutional. In my opinion, it's definitely unconstitutional. And like I said, I would want to vote to repeal it because that bill is also full of hidden taxes, and it also going to hurt small businesses too.
What about people who take the health benefits and don't pay anything for it? Shouldn't they be required to pay something? I mean, because everybody else pays for them to go to an emergency room?
Well, absolutely. Provide they have the wherewithal to pay for it, because the country that we are, we help people that are unable to help themselves. But if people are well-bodied and able, absolutely they must. Nobody should get a free pass. It's coming out of my tax dollars and coming out of your tax dollars too.
But isn't that the mandate that they put in there, that if people can afford to pay for the insurance and don't, that they would have to pay a fee instead?
Well, sure, absolutely. So they're going to pay a fee. We just want to make sure that people are paying their fair share of any cost, and it's not causing any undue burden to us, again, the taxpayers.
I'm not sure how this person who doesn't want to pay ends up having to pay in your world, in that system that you prefer. The way the law was written, if you can afford to pay for a subsidized insurance policy and you choose not to, then you have to pay a fine. And if
Right.
you don't pay the fine, then the IRS enforces the fine. That's the unconstitutional mandate that people want to get rid of. But what it means is that people who don't just choose not to pay for anything can still go to the emergency room and get treated, and everybody else pays.
Oh,
So how do they end up? How does that person, that selfish person, end up paying?
That one that just keep easy. You know what? Start charging the mandatory. What did they do? Which state was that? They charged like $10. Well, first of all, there is a problem. See, and you're in D.C., so you get a bigger picture. I've been all over the country, so I got a bigger picture. Here in this district, people have blinders. They think only here. New Jersey, in this state, we're on the path to socialized medicine anyway. And I always used my example of auto insurance. Auto insurance here in New Jersey 10 years ago, Geico, no. E-insurance, no. Progressive, no. It was just the few manufacturers, New Jersey manufacturers, Allstate, State Farm, whatever, the big ones that were just juicing the people. Now they opened it up and made it more competitive, although you could sign that little waiver that no frivolous lawsuit, which is actually, some people say, oh, it's unconstitutional, whatever. That's on its way to tort reform, okay, in a positive way. But same thing, we get the same problem right here in New Jersey with the medical. You go to the NewJersey.gov website and you go, for health insurance, they'll say they're recommended providers. They don't make it business friendly for insurance companies to come in here, because it takes $450, $455 was the quote I got if I wanted to have insurance, the low end insurance, to have something supplement my socialized medicine because I have TRICARE. If I was in New York, it would be $230. Now that was as of late last summer. If you go to Pennsylvania, $175. In North Carolina, it was $170. Why is it in New Jersey? That's a New Jersey issue.
Mm-hmm.
So now to answer your question, $170 a month is very, very, very affordable. I would say even $230 a month is very affordable. And
But if I choose not to buy it and I need medical care, in the United States, we don't let people just die on the street without medical care.
Right.
If they show up at the emergency room, they get treated. How do you make those people pay?
There's always going to be some. Same thing with car insurance. Do you think everybody on the road, let's go on Route 4. On Route 4, from here, Fairlawn, to 11 miles to the George Washington Bridge, at 6 p.m., you think everybody on that road has auto insurance? How do we make them pay? How? I mean,
But you were saying you definitely thought somebody should have to pay.
People need to be responsible.
How do you make them as a congressman if they choose to just say, I don't think I'm going to get sick, and then they get cancer?
Well,
how do you not make that become the burden of everybody else in society?
But there are things in place already. The health savings, those health saving accounts. So that's because I got a friend of mine who's got his own business. I talked them into doing that, actually. You got very high, you go to the doctor, you're gonna pay out of pocket to go see a doctor visit. But something catastrophic, you wind up with the big C word or anything like that, you have to have treatments and such, it's covered. And you can use that money from the savings, for that savings account to make the payments. There are things in place people aren't using. People are always going to buck the system. How do you force? Heck, let's think about, is healthcare was driving this country into the ground? I don't think so. I don't believe it is. If we are holding people accountable for that, we got to hold them accountable for everything. And how do you do that? We had the Stasi.
I'm asking you. You're running for Congress.
I'm saying, no, absolutely. There was the Stasi. Do you want to bring that into this country?
Sure, bring them in.
But
makes it easier.
It makes it easier. The easy way. Like when I was in the Army, I was telling my soldiers, the easy way is never the right way.
We're getting off track here.
I'm sorry.
But I apologize.
So the answer to the question is, do you or do you not believe in mandated?
Well, no, it's pretty clear he didn't
Absolutely
want a
not.
mandate, but it is also clear he thinks people should have to pay something, and it's not clear how that would happen. That's basically what I take from your answer. How they would be made to pay if they choose not to, and they become a burden to everybody else.
Well, there are people that are a burden to everybody else who are. You know what? A lot of times people talk about welfare. Welfare is like this percent of any burden. But there are people that use that. Heck, we were just somewhere, my wife and I, and the guy was telling me about this food stamp deal, this 2-for-1 kind of thing or whatever. What are you kidding? You kidding me? So that, there's always going to be people that try to get over. That's it. That's human nature.
But is it the government's responsibility to
Absolutely not.
make people be responsible?
It's a private industry. It's the medical industry itself. The hospitals can go after the people. That's what they have collection departments for.